Hello, everybody, and welcome back to our How To Corner. I'm your friendly neighborhood physical therapist, Will Gray III. In today's episode, we're going to talk about quad muscle tears. Before we get started, please like, share, subscribe, follow, comment, leave questions in the comment, and we'll be glad to answer them. Let's get going. Today's agenda, we will cover what are the quadriceps bilaterally, or what is the quadricep? Causes of quad muscle tears, signs and symptoms, diagnoses, treatment options, recovery timeline, returning to sports slash work, and prevention strategies. Now let's talk about the quad itself. The quad itself is made up of four muscles: the rectus femoris, vasti lateralis, vasti medialis, vastus intermedius, and those muscles function as your actual quad muscle. They actually are important in knee extension as well as being able to eccentrically help you transition power when you're jumping or landing. In addition to this, whenever you have a quad rupture, it's a very serious injury and it can limit your mobility and your performance. Now, let's talk about the cause of a quad muscle tear. For a lot of people, it's usually overtraining, overuse. There's some level of weakness that was there. You can have an issue with not being able to recover properly. It can cause your muscles to be a lot more vulnerable to tearing. Or you can have something as simple as sudden explosive movements, jumping, landing, cutting, and then you have what we like to call a traumatic tear of the quad. You can have direct impact, and as a result of those being a thing, you can experience a quad muscle tear slash rupture. Now, signs and symptoms, very simple, very, very simple. Usually we have a quad tendon rupture if it ruptures off the insertion point, which is going to be your tibia. It's going to roll up your leg. You'll see a big bulge. Or if it's an actual quad tendon rupture within the muscle belly, you will see a big divot, and that is followed by swelling, bruising, pain, decreased ability to be able to stand or straighten your knee out, as well as you will probably see also some swelling. Now, that popping sound is very, very noticeable. It's hard to, how can I say this, miss it. But in addition to that, that visible indentation I talked about with that muscle belly tear is even more noticeable. The diagnosis. How you diagnose a quad tendon tear or rupture? Pretty simple. Physical examination. There are certain tests we can do to be able to make to see if you have a quad tendon tear. One of those particular tests, if you do a knee extension, if you're unable to extend your knee, open chain extension or kick out, then your quad tendon is probably ruptured. If you have pain with extension in the area of the quad, that's most likely a rupture there on some level. You can rupture not the actual tendon off the bone. You can rupture the muscle belly, and it doesn't have to be all four muscles. It can be a part or one of the four, two of the four. And as a result of that, you may be able to extend your knee, but you're having immense pain, or your nose a big bulge or indentation, I'm sorry, in your actual leg. And those particular those particular diagnostic options can also be followed by MRI as well as ultrasound to confirm severity of the tear. Now, if you get to a point where you're trying to figure out which grade of tear is worse, one, two, or three, you have one that is mild, small tear, mild pain, maybe more of like a quad strain. You'll just be down for a little while. They won't require any surgical procedure. You can do conservative treatments and recover, pretty rapidly from that. Moderate is a little bit different, depending on the moderate tear size and how much swelling it causing weakness. There may be a need for some level of medical intervention besides just a conservative treatment. Just depends. And then the severe, most likely you're gonna have complete tear, complete rupture, loss of function. You're gonna have a surgical procedure unless it's the muscle ability. And sometimes they don't want to repair the muscle ability because the muscle ability itself is hard to basically stitch back together. You're basically putting mush to mush. I don't know, that sounds weird, but that's really what it kind of sort of comes down to. Now, treatment options, like I talked before, mild to moderate, anti-inflammatory medications, physical therapy for strength and flexibility, and depending on the severity of the moderate tear, it could be a little bit more medical interventions. Just depends. Severe tears, grade threes, surgical repair of tendon slash muscle immobilization following rehab. Mobilization followed by rehab. The reason that you have immobilization because they want to make sure that that particular surgery is protected and things heal back properly. So you may be immobilized for a while in order to make sure that everything does not come apart. Now, recovery time. This is just a rough deal as far as what we're using as an estimation of recovery time. If you have a mild quad issues, 4 to 6 weeks, moderate 12 to 18 weeks, and then severe 6 to 12 months or longer, just depending on the severity of those tears. Rehab focuses on regaining strength, flexibility, and preventing re-injury, as well as activation, right, of said muscles and control and stability. So we have a few things we focus on from a rehab standpoint. And the return to sport. This is the trickiest part of it all, okay? Reason for that is because you mustn't regain the full motion first without pain. It must be full motion. After that, you have to regain a certain level of strength also. And that strength is not just one type of strength. You have to have isometric strength. You have to have a concentric strength. You also have to have eccentric strength. And those are really hard to kind of sort of target when you're going to need them. So you have to strengthen all of them, whether that's wall sits, knee extensions, controlled descending off of boxes when you jump off or step offs, or like I said, just lowering in a single leg position. And then before you return to any sport, you have to be clear about the physician and or physical therapist. Really depends on your progression and who is best responsible for your return. And then even with that, there's a gradual return to make sure you don't have any issues that kind of sort of arise from your return. And then going forward, just making sure you're focusing on a proper warm up, stretching, and strengthening routine. Now, the prevention strategies are pretty straightforward. Stretching, flexibility training, strengthening are the most important. Being able to have that flexibility, have that strength, have that actual ability to be able to understand what your recovery needs to look like, and then rest, and then avoiding the overtraining and fatigue. Right. If you do all those, you have a better chance of being able to prevent a quad tear that's not traumatic in the sense of saying that the mechanism of injury was something that was external. And as a result, you avoid having these injuries as well as having a possible surgery. If you have any questions going forward, please let us know. We want to thank you for listening to this much of the talk. If you made it to this point, we really appreciate it. And please share this information with any of your people who have questions. And if you have further questions, you can always send us a message. We will try our best to answer those and give you the correct guidance. You can reach us at our Instagram, TikTok, as well as on YouTube or Facebook. And you can also email us at our website. Just go to 3gen.com and you will be able to go to our contact us page and leave a message. With that being said, I hope you have a blessed one. I'll catch you in the next one.